Hi, my name is Dr. Delia Garcia, and I would like to clear up some misconceptions about soy. First of all, let me tell you a little bit about my background. I am an oncologist. I did my training at Washington University here in St. Louis, Missouri, where I practiced oncology for 27 years, and my specialty was breast cancer. So I consider myself a breast cancer expert. I was on the faculty of Washington University for 7 years in the past. I'm a founding partner of St. Louis Cancer and Breast Institute. So I know a lot about breast cancer. I have over 50 publications and book chapters under my belt. Did a lot of research and educating of medical students and residents when I was practicing. So that kind of sets the stage that I do know what I'm talking about when I clarify this issue about soy. So soy, being a plant, is not poisonous. And unless a plant is poisonous, you don't have to worry about it. Soy has never, ever caused breast cancer. So I just want to set the stage for that. Soy has never caused breast cancer, but obesity or being overweight is a huge risk factor for breast cancer. And the reason why is that when someone is overweight or obese, it creates high circulating estrogen levels, it creates estrogen dominance, and it's the estrogen from our body fat that is a risk factor for breast cancer. So breast cancer, even carrying 30 pounds of excess weight, can be increased by 50% or more as a result of that estrogen dominance. Now, let me tell you about a study that was published in December of 2009 in the Journal of the American Medical Association, which is also abbreviated JAMA, J-A-M-A. And this was a study on over 5,000 women, all of whom had a history of breast cancer. And those women were divided into those who consumed soy and those that did not. The women who consumed soy had the highest survival rates. They had the lowest recurrence rates. Women who did not consume soy had higher recurrence rates and lower survival. So why is that? Well, soy, having natural plant hormones called phytoestrogens, or they're also called isoflavones, can bind to the receptors of cells, and they have a mechanism similar to tamoxifen. So tamoxifen is an anti-estrogen medication oftentimes used for the treatment of breast cancer, and soy can have a similar effect, binding to the receptors of the cells so that estrogen from body fat or from our ovaries doesn't bind and feed those cells. So don't be afraid about soy. Soy is a great source of protein. It's used by millions of women around the planet for prevention of breast cancer, as well as for just general good nutrition. Soy does not cause breast cancer. Soy is not poisonous. But what is poisonous and what does cause breast cancer is being overweight or obese. It increases our risk of breast cancer dramatically. So you want to get to a healthy weight in order to significantly reduce your risk of breast cancer. So I hope that clarifies these misconceptions that are out there. Thank you very much.